Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. Gout has become a big problem in this country over the past couple of decades. In fact, this form of arthritis now affects more than 8 million Americans, about 4% of the population. While there's no cure, it is one of the most treatable forms of arthritis. Here with what you need to know about gout is Dr. Neil Gonter, a rheumatologist with Rheumatology Associates of North Jersey, located in Teaneck. Welcome to the program.
Thank you for having me.
So gout, it's very common, it's very treatable. What causes it? I mean, where does it come from?
So gout is an inflammatory disease that's characterized by swollen joints and inflammatory arthritis, which is found with people who've got elevated uric acid levels.
Do we know where this comes from? Do we know, what causes this?
Well, while a lot of people have high uric acid levels, only a certain percentage get gout attacks. However, we're not sure why that exactly happens, but there's definitely some characteristics that make people more susceptible to get these attacks.
What are some of the telltale symptoms of people that have these gout attacks? What do they typically have?
So when you get a gout attack, the joints will turn, you'll get intense joint pain, you'll get lingering discomfort, inflammation, redness. And these are the symptoms of getting an acute attack, where the attack just suddenly occurs.
And when people have this, and by the way, we have a picture here. Can you just comment on this? Is this one of the most typical places that people get gout, in this toe area?
Yeah, that's correct. This is when you get the first attack. Frequently will occur in the big toe like this, called podagra, the most common form. However, understandably, this is not what most people have at the end of the day. This is the first time you get an attack, it'll be in this location. But there's multiple other joints that can be involved, all the other toes. It can happen in the midfoot, the ankle, the knees, the elbows, wrists, and hands. Also can be associated and affected by high uric acid and gouty attacks.
So and typically when people think of gout, they think of the foot, right? Or even the knee. But as you said, it can happen in the elbows, the shoulders, it can happen anywhere.
Right, that's where the problems really start. When you get 1 or 2 attacks, they go away, it's fine. But when you start having attacks in other parts of the body, you got to start realizing this is a progressive disease that's really taken root in all of the other areas. And you got to think about why that's actually occurring and what you got to do to make this resolve.
Now, are there risk factors? Are there typical risk factors that people need to be aware of when it comes to this?
Well, primarily diet has been associated with people getting gout attacks. Eating foods such as seafood, red meat, drinking alcohol products such as beer have in the past been typically associated historically. However, in modern times, it's not only diet that's causing it, but people who are obese, people who have got underlying medical conditions such as kidney disease, as well as other medication interactions, and of course genetics.
And coming to that, when we talk about genetics and we talk about also men are more at risk for developing gout, what do we know why men?
Not really sure why men are more susceptible, but it definitely occurs much more frequently in men, about 3 times as much as in females. And maybe there's,
maybe hormones
are involved, but as well as females do get gout attacks, but usually occurs about 10 years after men.
So, and then the other thing is, when we talk about the whole gout issue and the whole gout episode, when do we realize and when is it important to follow up with a doctor, and what do doctors typically do?
Okay, so there's a whole realm of things that can be done. The first time someone gets attacked, it'll occur fairly infrequently in 1 or 2 joints. Eventually it starts getting progressive, where uric acid remains elevated and people will get attacks on a regular basis more than a few times per year. At that time, you almost certainly should be seeing a physician. There are medications that go on to lower uric acid levels to get rid of that condition.
So there are prescription medications that can typically be used for this also, right?
That's correct.
And then how do we make the diagnosis of gout? I mean, obviously measure the uric acid level in the blood, but what else can we do?
Right, so the simple way is measuring uric acid and talking to your physician, understanding what the condition is, and other things that are going on with the body. However, there are other ways to diagnose it, that are non-invasive, such as X-rays, such as ultrasound.
And what are we looking at here? These are crystals, and how do you get this? Is this a biopsy of or an aspiration of the joint?
So this is from an aspiration of a joint. When there's fluid in the joint, the joint gets red hot and swollen. Fluid is removed, and then you can look it up in the microscope, and there's a uric acid crystal.
That's a single crystal.
It's a single crystal in a single cell. When the cell actually eats the crystal, causing inflammation and pain.
Now, can you biopsy? Can you aspirate that and look at that right in your office?
I can, yes.
So that's something that you would do if somebody came to see you. If their uric acid level was high, you would just put a little needle into the joint, take out a little bit of fluid, and you would look at that right under your microscope.
That's correct, and you can get a diagnosis right away.
All right. And what about prevention here? Preventing attacks. I guess watching your diet and all those things. But what do you think are the single most important thing that people can do to prevent the recurrence of gout?
I think that staying healthy is the most important thing. Losing weight and exercising to keep your body in good shape. Dietary prevention is also important, especially for the people who barely get attacks per year. If you're not going to eat too many frequent attacks, limiting your alcohol, especially beer, as well as other food products that can cause and break down to become uric acid. Right. Those are the most important things to do right away.
Well, thank you very much for joining us. It's been a pleasure to have you with us today, and thanks for being with us. Folks, stay with us. When we come back, I'll answer your email questions and give you my second opinion on Medicare's decision to try to prevent obesity. But first, here's a look at this week's Community Health Calendar.